Convention over at the Raleigh Convention Center is still a go, but organizers are making some major changes. Here's what we found out. Several interactive attractions are being replaced with less things to touch, more things to see. Staff will wear gloves during the event. They will not use hand stamps for re-entry. Instead, attendees will need to keep their tickets handy. They are also adding more hand sanitizers.
Right now, Duke University expanding travel restrictions for students, faculty, and staff because of the coronavirus outbreak. Duke now banning university-funded travel to coronavirus hotspots overseas, including Italy, China, Iran, and South Korea. And they're requiring a mandatory 14-day self-quarantine to anyone who has been to those areas. They're also asking students and faculty to reconsider any non-essential personal international travel. Right now, Duke is not restricting domestic travel. New at 5, the coronavirus continues. The number of cases soaring to more than 95,000 globally. And in the last 45 minutes, Washington State confirming an 11th person has died, bringing the U.S. total to 12. No word on if that person was living at that nursing home in Washington that has become the U.S. epicenter of the coronavirus outbreak. And of course, one of those cases making its way to Wake County after a man who visited that state contracted the virus before returning home. Our Ed Crump joining us live after speaking to emergency medical technicians who are on the front lines about the challenges they face. Ed?
Yeah, Tisha, the EMT that I spoke with says he's not at all worried. He's confident in his training, and he's ready to help others.
Most people in the healthcare field and EMS in general are in it for helping other people.
Jason Jones has been a paramedic for 11 years, 9 of those in Wake County. Today, he showed us what is known in the healthcare business as PPE, personal protective equipment. It's stored in every ambulance.
We've received a lot of information from our administration, and I think that we're very well prepared to handle any patient that we get, including those with coronavirus.
Jones says EMTs are already trained to use gowns and surgical masks for flu patients. The big difference for COVID-19, the mask.
This is an N95 mask. It has to be actually fitted for the provider, so every year we have to be fitted with a mask that is right for our face, and it provides a much higher level of respiratory protection.
But when an ambulance crew responds to a sick call, how do they know whether to wear the gear? The director of Wake's Emergency Medical Services says they use 911 dispatchers.
911, what's the location of your emergency?
The dispatchers are already instructed to ask sick call patients about flu symptoms, and now there are additional questions.
Given the concerns with COVID-19, is they're asking specific travel questions for patients that are calling on one that may potentially have influenza-like symptoms.
Dr. Jose Cabañas says county health officials are doing all they can to protect healthcare workers on the front lines in the event of an outbreak. And Jason Jones says he and his colleagues are ready to respond.
We're here to help the public. We're protected, so I'm not worried about a risk to myself. So definitely ready to respond and help others when needed.
And we're certainly grateful for that. Now, I'm told that once paramedics see a patient, if they see someone with COVID-19, they have a special disinfectant to clean up that kills the COVID-19 virus. They tell me, Tisha, that's not just to protect them, but also to protect the next patient they may see.
Now, listen, we have the second case of COVID-19 in North Carolina. Y'all can get mad because I'm posting this on my channel. Y'all can leave my channel. I mean, I don't do this for likes. I do it to bring awareness. And I'm in South Carolina. And this is surrounding me now. Florida, Georgia, North Carolina. We are surrounded by the COVID-19 virus. So yes, you will see videos on my YouTube channel about COVID-19.